Somebody's got the L.
Hey, I'm clean.
I just walked through a closet. I think so.
It's
Must be the jacket.
it's emanating in waves.
You smell it too. They're gonna think it's you. They're gonna think it's me if I
I am so clean, it's not even funny.
Are you good? So fresh and so clean.
Yeah, pretty much.
Oh, you're the
Videoer.
Yeah. My hair looks cool like that there.
Every time you see me,
I wish it actually looked like that.
Yeah.
oh, I got one in the car. We have a collection site. Oh no, I think it's the tail. You're probably right. I used to live in the bush. It's fine.
Oh wow, you guys work really hard.
That's what I thought, but I honestly can't. I know.
That feels real. That's straight. It doesn't feel very straight, though. It feels perfect as fuck, bro.
Okay, what's up?
That feels crooked to my brain.
Well, the sister I used to have in a little bar.
That's always a plus.
Oh my god, I feel very convinced eyeshadow is the glitter stuff all over my hands right here. And it will forever.
So you got the sparkles on.
Yeah.
You got a sparkle stand.
Actually, I'm talking to
If anyone's here that you don't like, you can just accidentally rub. I've seen strangers. You can just trip. Yeah. I know. Running the and also signaling when it's time to do it. I'm going to turn my schedule to a paper What? I don't have any straws. All I need are 2 pens and strong rubber. And I can literally shoot a forecast. That strong iron stone trooper right there will shoot me. You gave me one already, so...
This is my son.
cannot wait till Overdose. Like most of the other Facebook Lives.
Hi everyone, how's it going? Yay! My name is Kyle. I am a longtime friend of Elbert, and after he passed, I wrote a song in memory of him. So I'm with my friend Alyssa, and we're going to perform that for you right now, and then we'll kick off the event. Rest in peace to Elbert. We go back to your very first birthday. We were kids and our families were the tightest. We did everything together, never thought twice to invite us. See, you were like the younger brother that I never had. In fact, you always were. That's crazy, man. It trips me out just to sit and reflect. Like the throw you curveballs that you didn't expect. From divorces to breakups to family feuds. Went to families of many to families of few. So when our parents split, we split too. But we were just kids, didn't know what to do. So we drifted apart and went our different ways. But I'm glad that you still kept in touch with my sister Tay. Time passed and we both grew up, led different paths, but into similar stuff. So you loved hip-hop and I do too. That's why I made a song in memory of you. I'd love to go back to when we played as kids, but things will never be the same. That's just the way it is. Oh yeah. Now I'm shedding tears as I write this song. And even though you're gone, your spirit lives on. Your family's so strong, you would sure be proud. Cause it took a loss, and now they reach the crowd. They got people everywhere that are living for lolly. So you lifted our hearts from the melancholy. It's sad to say, but your story isn't one of a kind. It very easily could have been one of mine. Cause I got many friends who were down the same route. But not everyone's lucky enough to make it out. So even after death, you're making a change. It's strange how the world works, can't always explain why the good die young. The hood life's done. If you want drugs in the burbs, you can find some. It's time people wake up and realize the truth that no one's immune when it comes to drug use. Who would have thought you could ever fall into the trap? It only takes one time to sneak you like that. And perhaps you pass just to help another kid live. Then that's the way it is. And that's just the way it is. Things will never be the same. And that's just the way it is. Oh yeah. Oh my. Things will never be the same. That's just the way it is. Oh yeah. Thank you.
Well, welcome. Sing on. There we go. Welcome. My name is Phil Atterbury. I'm the board chair for Live for Lolly, and I wanted to, of course, personally welcome everyone for coming tonight and showing your support for this incredible organization. It's amazing to think about what's happened over the past 10 years. Also, what's going to happen in the future. You're going to hear more about that tonight. And as Live for Lolly will probably tell you, and Chelsea and everyone that's been part of Live for Lolly, it's just not them. It's everybody. It's everyone that's ever volunteered or been a part of Live for Lolly through its 10 years. So one of the things that you're going to see is you're going to see some people that have this purple on here. Those are current Live for Lolly members, volunteers, board members. If you have any questions about Live for Lolly for tonight, please just, if you want to go and say hi to them. They'd love to talk to you, of course. As the board chair, I have to also do this. I have some things that I have to do as well. One of the things that we're going to be doing this year for the 10th anniversary is we have a capital campaign. So we'll probably be calling you later. Because if you're unable to support by volunteering, of course, we have a lot of great projects going on this year that need your financial support as well. Also, another mission that the board has is and it's to anyone in this room or anyone you may know. We're looking to increase our board. So if you'd like to participate as a board member, please, once again, ask myself or anyone else that has a purple thing about any information about becoming a board member. So, without further ado, I'd like to introduce Chelsea to talk about Live for Lolly.
Hello, friends faces. Nice to see you all. Okay, I've got to move my pregnancy chair out of here. Thank you so much for being here. I am very overwhelmed by the love and support in this room. I'm sure like 90% of it is hormones, but most of it is gratitude, much gratitude. On behalf of my family and Live for Lolly's staff and volunteers, I want to welcome you all to our 10th anniversary kickoff event. I want to say first a massive thank you to Staci, Allan, wave please Staci, who developed our strategic plan and has been working with our board and staff to execute much of what you'll hear about tonight and witness this year. So our Live for Lolly staff and volunteers came together in November to develop the theme, which is Stigma Ends, Hope Lives. After all, we are the ones on the ground connecting with those who have felt invisible or who have been told they are not enough or worthy of compassion and care. We're helping families recover. We're helping communities put action plans together, crafting and pushing legislation, and actively tracking this beast of a public health crisis. We are a family. So I want to take a moment to introduce them to you so you're familiar with them. So if I call you, please stand up where you are and wave. First, Jody Deichman, who needs no introduction, my mom. You know, she does a lot of stuff. Laura Fry, Director of Patient and Family Services, and Program Manager. I already introduced Staci, but if you'd really like to, okay. Alexander Matheson, our Outreach Coordinator from McHenry County. Amber Mickey, another Outreach Coordinator from McHenry County. And Jamie Mastriani, our Communications Coordinator. There are many, many, many faces behind Live for Lolly and people who do a lot of work to help families. We are also blessed with a wonderful group of volunteers who dedicate their time and their talents to help us fulfill our mission. Without them, really none of this is possible. So I'm going to just point a few out for you. Lori Clapman, will you wave? Our Smart Recovery Facilitator, Overdose Educator. I don't think Stephanie, Courtney, and Jess are here yet, but that's okay. Our Angel Moms and Siblings Committee, the table over here, Amy Alderson, and Sharon Gallagher, and you can heal after tragedy. I think we're all proof of that, sadly. So I want to start out by reflecting on our journey. On December 15, 2008, my little brother Alex Laliberte died tragically from a polysubstance overdose in our home, which was just a few minutes away from here. For me, Alex is the driving force. He sets the course. He gets me up every morning and puts the fire in my belly. He pushes me to motivate others, and his memory reminds me that we have a lot of work to do. Because here's the deal. In 2017, more than 72,000 people died from an accidental overdose. That's 192 Alexes dying daily in America. That's a plane crash every single day. That figure accounts for more than car crashes, homicides, and suicides. And those figures are not going down. They are increasing rapidly due to the influx of fentanyl, its presence in all street-bought drugs, and the various systems struggling desperately to keep up with an ever-changing epidemic. Nationally, we are not winning this. Statewide, it's also looking pretty grim. Locally, we have managed to embody and embrace the true meaning of think global and act local. Because of your support, the community collaborative we are proudly a part of, and the evidence-based strategies we are utilizing daily are making a difference. Take a look at the 9-year analysis of overdose death data in Lake County, where our work began and is still vitally important to our programming. In 2009, 82 overdose deaths occurred. Last year, in 2018, 92 overdose deaths occurred. Now, one can chalk that up to an unfortunate increase in deaths, but we know that this epidemic could have landed us into the hundreds of deaths annually. We know that. We know that this epidemic could have done that. Statistically, that number should be doubled or tripled. Actually, without all of the comprehensive strategies we have implemented, we would be in the 200s or 300s. I think that's important to note. You wouldn't know that just by reading Coroner Cooper's statistics, but we know it because we're constantly tracking this crisis. Each one of those deaths, those numbers, was a human being with dreams, thoughts, feelings, emotions, and people who cared about them. Their lives mattered. The bottom line, every death is preventable. And that is the approach at Live for Lolly, and by proxy, what the Lake County Opioid Initiative has taken on. Our panelists from Lake County We'll educate you later as to how we have managed to stay below the national markers and what more we can do to decrease these deaths. So Live for Lolly is how my family has healed through this tragedy, and I get to hear stories all the time about how it's helped other families and communities recover as well. I recall sitting on the couch during Alex's Shiva and talking about how we could have prevented all of this. At the time, it was so confusing because in order to avoid a cautionary tale like this, you'd have to see a problem coming. Then you'd have to believe it exists, and then you'll need the knowledge and the tools to address it. What I know now is that stigma, culture, bias, beliefs, and our own unique life experiences did not allow for that to occur in our lives. The mission was always quite simple. We decided as a family that we were going to put our issues aside and come together to keep Alex's memory alive by keeping others alive. That's why we are here. We had no idea what we were doing, but we didn't care. Because when you're heartbroken through a loss like this, there is literally nothing else that compares to the pain. It's an awful experience, but it can be a great recipe for going the distance to try and make a difference. Along the way, I've learned a lot of life lessons about life, social issues, nurturing a movement, running an organization. So I thought I would share some with you as we reflect on our work. So in 2009, when we started spreading the word about substance misuse and overdose, people did not want to hear what we had to say. You say the word heroin and it's crickets, or people immediately want to walk away from you. So judgment was rampant, it still is. So we quickly knew that we were going to have to be brave, talk about this in our community openly, and accept that people are not going to like it. Our first mission was simply to spread awareness, and that we did. We'd show up at festivals, farmers markets, community events, forums, you name it. We were there with a big, bold sign of Alex's face next to the word heroin. Or other non-conventional measures, like my dad throwing golf balls at people during his Wake Up campaign, or whatever he called it. Because we were going through our grief process during this time, our style of communication was a bit abrupt. My mom is actually the OG, the original gangster of advocacy on this topic. However, she'd never believed that. This 2009 Daily Herald article articulates exactly how much heart and soul she has, acknowledging to the world that she felt she didn't do enough as a parent. It is one of the bravest things you could do as a human being, because it is admitting that you are in fact human, and she acknowledges this first time publicly in a Daily Herald article. She stood up at the Buffalo Grove Town Hall, where Overdose was addressed for the first time, and she said, "What are you guys doing about this?" Sidebar, yelling at people, while momentarily therapeutic for the yeller, is not always a good idea. We learned that. Are you having technical difficulties over here? That's okay.
We're good.
But it got their attention. At the time, no one knew what to do about this issue, or that there even was an issue. The police in Buffalo Grove were tracking fatal and non-fatal overdose rates, but that didn't necessarily translate out beyond the department walls because the veil had not yet been removed. So we came to learn that the voices of those impacted start movements and mitigate crises. Hi, babe. There has to be a whistleblower. So we knew that the first phase of our work needed to be laser focused on removing the veil, getting people talking, and hopefully others who have been through what we have been through will come forward because they will be less afraid. They too will decide to fight stigma. And guess what? It worked. Bold, passionate, purposeful action helped kick off a movement in this state when voices were given to the voiceless. That's how you shatter stigma, shame, and silence, and that's how you reveal truth. Another lesson learned through our work is that the truth is heartbreaking to accept, but it's the perfect fuel for change. Beliefs and experiences drive our states of mind and motivate us to feel or act. That's definitely my story. However, data and science can and never should be ignored. They should really be driving change too. So in 2013, I went to work at my first gig in this industry as a fellow at Roosevelt University's Illinois Consortium on Drug Policy under the leadership of Kathy Kane Willis and Stephanie Schmitz-Bechtler, who taught me how to advocate thoughtfully and urgently, using science to promote sensible solutions. They knew that Illinois was one of the worst states in the country for publicly funded treatment, that communities of color and women would suffer the most, and that fentanyl was coming. They designed Live for Lolly's current operating model and the Lake County Opioid Initiative framework based on their studies of this crisis, including projections of how bad this would actually get. They utilized my chutzpah and gift of gab to get the message out about overdose prevention and evidence-based treatments. At first, spreading this message was terrifying because the counter perspective I received over and over again from politicians, police officers, judges, and even treatment and recovery programs, which was bizarre to me, was my least favorite question in the world. Aren't we enabling people to keep using? It's a widely accepted fact that recovery is not possible without a pulse. But it wasn't so easy convincing people of that years ago, and I knew why. And I had to change my beliefs to challenge other people to do the same thing. It was, and at times is, difficult for average folks to separate out the idea that while drugs are bad, people who use drugs are inherently good and deserve to recover, or that recognizing that just because someone is not ready for treatment doesn't mean that they are a failure and unworthy of support. As the death toll increased, pressure was put on every community in this country to step up and implement strategies to fix this issue locally. The domino effect began for us when the Prospect Heights Police Department decided that they were going to be one of the first in the state to implement an overdose prevention program, utilizing our training and working together to build protocols. They saved 5 lives that year. As the message got out that harm reduction works, we were called to help develop and lobby a bill that would end up becoming the first in the country to institute specific comprehensive directives around the heroin crisis. Only 5 more pages, guys. After a very enthusiastic experience witnessing the override of Governor Rauner's veto of Heroin Crisis Act, what a fun day that was, right, Laura? I don't know. Yes. Which came to be called Lolly's Law, thanks to Senator Melinda Bush. Illinois became the first state in the country to mandate that Medicaid cover all forms of medication-assisted treatments and naloxone without pre-authorizations or utilization codes. It created the pharmacist prescribed program where anyone could access naloxone with a brief training at their local drugstore, and it instituted many liability-related immunities that helped first responders, schools, and villages set up programs to quickly respond to substance use crisis with ease and without legal ramifications, which is a huge deal if you are a police officer or any entity going out and saving lives. Even the Stevenson High School nurses jumped on board. They're so cute. Every step proved that our message was getting out there. Stigma was slowly dissipating, and solutions were embraced instead of challenged. And then along came Bob. Former Congressman Bob Dole, a moderate Republican from Kenilworth, who in a very short amount of time was somehow able to champion a bill to provide resources to states for naloxone distribution programs that this country is still benefiting from today, thanks to the Comprehensive Addiction and Recovery Act, or CARA, which was signed by President Obama in 2015. And Bob is now a board member, and he's not here tonight, but we owe him a debt of gratitude. In short, we have been fortunate enough to participate in some truly game-changing work that has helped put the collar counties in a safer place than when we started. Passion, data, and using our voices created this change. So one of my mentors in leadership is an incredible man called Brian Stevenson, who is the founder of the Equal Justice Initiative, which is a Mississippi-based legal advocacy organization that tackles the injustices imposed upon people wrongly accused of crimes and inappropriately incarcerated. He promotes the philosophy that in order to lead well, we must do uncomfortable things and increase our proximity to those we serve. I will repeat that. We must do uncomfortable things and get more proximate to the people we serve. We must challenge ourselves to create change. That has become one of my personal mottos for social justice work. So to translate this into Live for Lolly language, we are committed to delivering programs where we are wrapping compassion, or our arms, literally, around those suffering, listen to them, learn from them, and meet them where they're at. By showing people who use drugs, their families, and the loved ones left behind due to death, that we love them, slowly self-love and healing grows. These are some personal heroes of mine, the Angel Moms. Angel Moms. In 2015, one of the driving forces for launching our walk-in clinic, which is now called the Community Recovery Center, which is in its 5th year actively promoting a safe haven for thousands of members of the community, was the impact of these ladies and other families needing increased supports. We wanted to provide a space where people could safely access connections, education, resources, safe supplies, a shoulder to cry on, you name it. It also became a headquarters for our operations. Providing recovery support services with the incredible directorship and abilities of Laura Fry is our secret weapon. She is our secret weapon. She and the outreach team are literally on the ground daily providing services to those who have felt invisible. They are finding homeless encampments. They're bush diving, as I call what Alex does, because he's really good at it.
I'm a bush diver.
Walking into drug dens, literally catching folks coming out of the courthouses simply to let them know we are here and lend a hand, or maybe even a fentanyl test strip, which you can get up here later on. They are meeting with families who have felt frustrated and scared by their loved one's substance misuse, building recovery plans, providing screenings and triaging families, not just users, to various levels of care. By bolstering the resiliency of the entire family unit, we can help empower them to make choices about their own care so that everyone can heal individually yet together. It's so easy to feel stuck when there's no objective guidance. But without the concept of meeting people where they're at, it's hard to build trust and encourage people to keep coming back. Our services are never limited by number of interactions, types of goals, or expectations folks might have about what should happen. In fact, we don't use the word should because these families have been shoulded into submission. We want to continue to offer this service for as long as we possibly can, but can only do so through the help of each of you. Which brings me to my final lesson. There is no I in team. We are one big family trying to conquer something that's much bigger than each of us. We are only able to do this because of our community, your support, your love, your donations, your resources, your time, your faith, and your skills. Live for Lolly started as a volunteer-based organization. We could never have dreamed to have a paid staff during this work, ever. We never thought that would happen. So in my final moments up here, I want to thank each of you for being here and for all of your years of service. And I want to ask you to keep fighting along with us because our work has just begun. 10 years is still childhood for an organization. And as you have seen from the data, we are not out of the woods. We have a lot of work to do. So if you have the time, connections, resources, we would be grateful for your continued support. As you have learned, we have a goal of raising $150,000 by the end of the year, and truly could use your help to achieve that goal. And if you are interested in finding out how you can help, you can talk to any member of our team about how to be involved. They're wearing the purple Stop Overdose ribbons. You can also head to tables over here to learn a little bit more, sign up to become a volunteer or join our board of directors perhaps. But before we move into our food portion, which I know you're all excited about, and then onto our esteemed panel of experts, my friends, I want to share with you what you can expect in the coming days. Starting this year, we are taking it to the streets with our mobile outreach initiative, thanks to the support of our vision by Inspiration Outreach Foundation. Staci, can you just wait for a second? Let me tell you why this is so important. This is an example of a widely circulated type of image, a swath of used needles sitting in a park. Needle exchange programs end up being blamed as the source of such a result. But in reality, this image comes from a community in Philadelphia without such a program. If it had one, you'd see more images like this. It's very simple. If we cannot connect with those most in need and at highest risk, we will see the death toll increase. We will see more needle sticks and community contamination. We will see increases in hepatitis C and A and HIV, which are all on the rise. Jill is here from Caring Ambassadors, and she can tell you, if you want to talk to her and bombard her later, how bad the hep C problem is right now. It'll blow your mind. We will continue to pay for emergency visits for chronic illnesses associated with drug use and overdose. Did you know that people who use substances are 5 times more likely to access treatment simply by participating in a wraparound harm reduction program like a needle exchange service. We don't know how else, we can't track how else people access treatment, but we know that needle exchange programs connect people to care. We all know that in the suburbs, it is very challenging for people to get to us. So we want to go to them. We hope to launch our mobile outreach initiative in the summer and have RVs on the ground providing basic needs, medical care, harm reduction supplies, recovery coaching, and of course, access to treatment in August across suburban Cook, Lake, and McHenry counties to start. And we are in the process of engaging with DuPage County as well, thanks to our partners at Hope for Healing, Roger and Steve, raise your hands. All about collaboration. We're very excited because this really is the final frontier in wrapping around services to combat this epidemic. This has not been overly embraced, this concept. We are in the process of launching a fentanyl public service announcement campaign featuring this poster, which was co-designed by our team and Chicago Recovery Alliance. So in the coming weeks, members of the public will be able to share this image on social media or print off and post flyers and postcards in their local place of business or public building. It's quite alarming that people really don't grasp the severity of fentanyl. If you are buying any drugs on the street, whether you are a longtime user or whether you're going and getting some cocaine for recreational use at a party, it has a great potential for it to be laced with fentanyl. And we have noticed a huge denial among parents, families, youth advocates, and even treatment professionals about how at risk people truly are. The tiniest dose can kill. So we have materials at the back table for you to take with you, and please keep following us on social media and our email blast to learn how you can help us share this information with your networks. This is going to require a community response for it to have an impact, definitely. Starting last summer, we partnered with Heartland Alliance to co-chair a large committee of providers across Northern Illinois to develop additional public policy strategies to combat the opioid crisis. A 33-page document of recommendations was developed across 7 key pillars and then was whittled down to a 2-page letter to Governor Pritzker's transition team. It became pretty apparent which strategies needed to be legislated in order to create more change, and out of that came SB 1828, which Senator Melinda Bush is the chief sponsor of. We just had our first successful milestone as the bill swept through the Public Health Committee on Tuesday with a vote of 7-1. In fact, it was so well supported that they didn't even call for testimonies, actually. What will this bill do? In short, it will prioritize the highest needs communities receiving overdose prevention and supplies, institute a statewide treatment needs assessment along with recommendations for the state to institute following that, and will officially legalize needle exchange and syringe service programs through the Illinois Department of Public Health to protect those operating and participating in such programs. Currently, to operate an NEP, you need a research exemption and a really understanding law enforcement community, or you need Mike Nerheim. One of those factors in combination. Streamlining the process for operating such a program and increasing civil protections for those utilizing the program. And please, helps us expand these services, keeping people connected to care and alive. And as you can see, we have a whole list of supporters from ACLU of Illinois to the National Association of Social Workers and the Coroners Association. So this is really picking up a lot of steam. Finally, we want to keep doing what we are doing. Our model is working. People have a lifeline to supportive, comprehensive services, and eventually we'd love to expand our scope to a 24/7 model, around the clock. Wouldn't that be fun, Laura? Taking calls around the clock. We'd love to hire, well, she already does secretly. No, I don't tell you. We'd love to hire recovery coaches, counselors, providing individual and group therapy, and even provide medication-assisted treatments at our office. We'd love to have recovery meetings every hour of every day if we could, and case managers available, affordable housing. We will keep fighting for these services and for our clients. As I bring a new life into this world in just days or weeks, I pause often to think about what I am bringing him into. I don't want him living in a place led by judgment and fear. I don't want him to believe that he's better than other people. I want him to know that it's okay to care about others and feel his feelings, that he matters, and that he is enough. So I will continue to fight for this dream of mine by fighting for all of you and your loved ones and those I have yet to meet. Please join us as we continue our journey together. Thank you again for being here and for helping us to make this organization what it is today. I am truly forever grateful. So I'm done now, but please grab some food and beverages, mingle. We're going to take about 5 to 7 minutes for you guys to just chill out, go to the bathroom, do whatever you need to do. And then we're going to have our panel, our esteemed panelists, please come up here and we will get started on the panel. So thank you so much.
You always speak from the heart. You are amazing. You're going to be a great leader. You are. I mean, the words you use, you're going to be such a great. Well, my husband and I, we live in He's like, oh, I'll be there at
'Cause I accidentally, like, what do you want, I accidentally? Yeah. I was like, all right.
Lift close. Turn green. Fuck you. I have some arthritis,
You and I have to share. Good on. I was teaching probably drop a water to ask. On camera. You cut in half. No wonder.
To get some more food or to use the bathroom, please do. That works. So again, my name is Staci Allan. I came on board at Live for Lolly in July as the Director of Development. So I want to personally say thank you to everybody for coming. This is so exciting to be able to come together and not only really acknowledge the accomplishments of the last 10 years, but have the opportunity, as you heard from Chelsea, to talk about the future. And so we are very excited to have each one of you as our partners here to talk about Live for Lolly and talk about the future. I want to take a minute to thank our panelists for coming out tonight to help us address the crisis now. And so I'm going to give everybody an opportunity to introduce themselves and to talk a little bit about who they are and what brought them here tonight. Who's got the mic tonight? Mike does. Thanks, Nerheim.
Is that?
No.
How about now?
Now it's working.
Come on.
Now it's working.
Yeah.
Hi. My name's Leoni. I'm a person in recovery from substance use disorder. And I was asked to come here just to be a panelist and whatever that even means. But I'm here because Live for Lolly has helped benefit my life in many ways and helped save my life. And so that's why I'm here. Good evening, everybody. I'm Mike Nerheim. I'm the Lake County State's Attorney and, more importantly, a co-founder of the Lake County Opioid Initiative with Chelsea. And very proud to be here tonight. I'm here tonight because Chelsea told me to be here. We all know when Chelsea tells you to do something, you do it. So, Staci's kind of taken on that role now too. But just really happy to be here tonight and really proud of Live for Lolly. And it's Chelsea tells a story a lot about how her and I first met. It was at the Lake County Fairgrounds back in 2011, and she had a little booth at the back of the room, and she was trying to get people to come up and talk about heroin and opiates. I was going around trying to talk about the same issues because when I was running for state's attorney before that, I had been a defense attorney in Lake County, and I lost a lot of my clients to overdose. And I knew this was an issue I wanted to take on if I was lucky enough to get elected. But as Chelsea talked about earlier, back in those days, and it's still bad today, but it was worse then, nobody wanted to talk about this issue. And when you talked about heroin or brought this up, you know, you got put at the back of the Lake County Fair. But we met each other, and we both had similar goals. And those of us that have met Chelsea know that it takes about a second and a half once you meet her to realize that she's the real deal. And, you know, she's going to get things done if she puts her mind to it. So it's been a lot of fun to watch you and your organization grow from that little booth at the Lake County Fair to being a nationally renowned expert in this field. So I'm proud to work with you and proud to be here tonight.
I'm Jerry Mourning, I'm the chief of police in Arlington Heights. I'm also here because Chelsea told me to be here. Live for Lolly has been instrumental in setting up locally based Arlington Heights programs, and we're indebted to Chelsea and her whole organization. So far, so good.
Hi, my name is Sandy Hart, and I serve on the Lake County Board. I've been on the board for 6 years and now currently serve as the board chair. And I'll make it a trifecta. Also, Chelsea said, hey, you know, I'd really love for you to serve on this panel. Yes, I will be there. And I first met Chelsea when State's Attorney Nerheim was new in office, and he sent out an invitation to the county board members and said, hey, I'm kicking off this Lake County Opioid Initiative with a couple of other people. Would sure love it if you could join. And unfortunately, I missed the first meeting, made it to the second meeting, and have been kind of going ever since, right up until recently. So I'm getting my feet wet up at this new role. But I just am in awe of the work that the Lake County Opioid Initiative has done with Chelsea's guidance and support, and like pushing her way through all the obstacles I think that get thrown up there, right? So Lake County Opioid Initiative, like no money, that's okay, right? Well, we don't really have anybody to lead this one group, and that's all right, and we just keep going and doing great things. And I think it's really a model for other organizations in Lake County and really probably nationally to say, you know what, we don't need to worry about all of this structure and money and grants, at least when you're starting the ball rolling. What we need are people who care and people who are willing to kind of roll up their sleeves and get it done, and that's what I've seen from Chelsea from day one. So I'm really grateful for all the work that she's done, and she's going to be an awesome mom.
Beth Dunlap. I am an addictionologist and a family doc, and I've been working in Lake County for the last 5 years. Like the rest of the panel, I also have a hard time setting boundaries. But I am here because I love truly what I do every day, which is to be able to sit in the same space with my patients and their families, and to have a small part in their recovery. And it's humbling and wonderful and amazing, and it doesn't feel anything really like work. It just feels like what I was always meant to do. And when I went for the first time to the Resource Center at Live for Lolly, I realized that I was stepping into what felt to me like a sacred space. And I felt like a part of me had finally come home. And it was exactly what I needed and what my patients needed. And I've had the honor and privilege of working with the organization and working with my patients and seeing on the ground the way that they say in those lives. Oh, sorry.
Mic is off. You just gotta hold it down.
And we muted it now. I don't know.
It's in a good rhythm, too.
No. Oh, well. Maybe I can just talk a little louder. Or Laura.
I want to give her that for giving her everything.
There you go.
I don't know how she does that. Magic. It is magic. And so as I was saying, I have had the privilege of being there with patients and with families and being able to give a mom Naloxone from Live for Lolly and knowing that she, that same night, saved her son's life from an overdose. Or give someone in the clinic clean syringes and know that I help prevent hepatitis C transmission. And all of that came through the work of people like Laura and Chelsea.
I'm Diane Gieser, and I met Chelsea about 4 or 5 years ago.
She was doing an internship. Is it on?
Good.
Now is it on?
No.
Hold it in, Diane.
I'll show you. How about that?
I'm not going to touch the button. Okay. So I met Chelsea. She was doing an internship at a treatment center in Vernon Hills, and the people that were supervising her said, "I'm leaving, would you take her on?" And boy, I felt like riding that wild horse when I met her. She was all over the place. She was an intern. She was doing Live for Lolly. She was just had so much energy. But she challenged me in a way with my thinking. I've been in the field of substance use for is probably longer than Chelsea's born. And she challenged me to look at harm reduction, and she challenged me to look at a lot of ways, things that I believed. And I'm proud to say I have fentanyl strips in my office today, and I know what harm reduction is. And I just love the work that Live for Lolly does, and I'm here like the rest of us. Chelsea told me to be here, and but I want to be here, and I believe in what they're doing, and I believe that it's helped me get a different mindset. And I do a lot of training, and I'm helping the people that work in this field change their mind about how we deal with substance use. So I'm proud to be here, and I'm glad I know Chelsea, and I think she's going to be a great guy too.
All right, one quick thing. On your table should be some index cards. So as we're going through the questions that we have, if you think of a question that you have, then write it down and hold it up. And Amber, where are you, Amber? All right, so hold it up, and Amber will come by and grab it from you. And then we'll address those at the end, and we'll also have a time to do a Q&A. But if you think of a question while this is going on, please write it down, hold it up, and Amber will come by and grab it. All right. So the first question goes out to Sandy Hart, and then to State's Attorney Nerheim. Chelsea went over a lot of data regarding statistics for Lake County, including the fatality data over the last year and year previous. Do you want to, can you give us a take on what you think about that data, what we're doing well, where the gaps are, and what we need to address? So, Chairman, you do it first, and I can give it to State's Attorney Nerheim.
Thank you. I'll do my best. So this is sort of timely. I had met with DuPage County on, I can't remember what day it is today, like on Monday, and we discussed their heroin epidemic and what fentanyl is doing to the folks who live in DuPage County. So I think you're saying obviously we're seeing that number reverse, right? We were on a downward trend, and then now we're seeing that spike up, and Chelsea spoke to it when we first got here, and I think it's really about fentanyl, right? It's about fentanyl. People aren't prepared for it, but I think it's also about when people relapse and they're using too much, or they come out of jail, they're not given the treatment that they need. It's difficult for them to find an appointment. I recently learned that Illinois is one of only 15 states in the country where we terminate when somebody's in our jail, and that can be for a nonviolent offense or whatever, but they're in our jail for X amount of time, their Medicaid coverage is terminated. So when they come out of jail, they have to re-register. So how long does that take, right? So they've got to re-register, sit down, maybe somebody's in transition in where they're living, so they've got to figure out where they're going to get their card, and then they need to make an appointment. So to me, it's that gap in treatment is the real problem for these folks. So that's something that I did reach out to Senator Bush, and we discussed that. I've reached out to a couple of the House representatives as well to say how can we move Illinois to the other side, where at least maybe we move to suspension, or actually just don't even suspend it, because it's not like they're going to the doctor other than the doctor that's in the jail. So why create this extra paperwork, if you will? So I think that has to do with it. I think there's a lot of education that needs to happen. But I, for one, do believe in a needle exchange program. It has been successful in other areas. I agree with Chelsea that those images that we see there, when you don't have those programs, we know, many STDs are going through the roof in Lake County, and some of that is direct results of increased drug use and needle sharing. So, sorry if I talked too much on that.
So as far as the numbers, I mean, we're frustrated by that number. It's difficult to, when you think about all the work that we've all done together in Lake County through the past 6, 7, 8 years, and to see those numbers go up is frustrating. And to see those tick up it's not going to discourage us, but it is frustrating. But it's also, I think, an opportunity for us as an organization, as a community, to pause and reflect on what's working, what's not, and fix those things that aren't working so well. And one mistake we can't make is to feel like, hey, we're doing such great work, we're in the clear now, because we're not. We're far from it. And our goal from day one has been, and I know this is audacious, but it's always been to get to 0. And that's going to continue to be the goal. So frankly, if we had gone down 20%, I'd still be disappointed, because we need to get those numbers down. Now, I think there's a lot of reasons why, in a lot of ways, I think we do that. There is no one cause of this epidemic, and there's not going to be one single solution. The lawsuit we filed against the opioid industry is hopefully going to help. That's not the only solution. Our Way Out program continues to grow. We have some things we need to do to tighten that up so it works better, but we're approaching 600 people that have walked into police stations throughout Lake County and asked for help. But that program needs to get better. We need to make sure we're getting those folks long-term help, because treatment capacity continues to be an issue, and it's scary when you think about Lake County. Like all the collar counties, we're very resource-rich in our community compared to most of the rest of the state of Illinois, and yet we still struggle. So we think about the problems we have in Lake County, but when you consider the rest of Illinois that doesn't have nearly the resources we have, it's really scary, because this isn't just a Lake County issue where DuPage or Cook, it's all of us. And but I really do think that the secret is all of us continuing to work together and come at this from a lot of different angles, whether it's prevention, harm reduction, you name it, programs like the Way Out, naloxone, making sure all of our first responders continue to be equipped with naloxone. There's all sorts of issues we need to make sure we continue to work on. And also with regard to data, we also, I think, have to do a better job of getting the non-fatal overdose data much quicker, because we get great data from our coroner's office, but unfortunately those are situations where somebody's passed away. We need to do a better job of getting that on-the-spot data as people are overdosing and being revived, so we know where we have issues occurring in our community, so we can divert resources there. There's programs that allow us to do that, and it's just a matter of getting people on board. So I could go on and on and on, but I'll stop and wait for the next question from Staci.
And I just wanted to mention, Cook County and the surrounding suburbs actually saw a 17% decrease in fatalities. So, Chief Mourning, did you want to address anything about Cook County? Because we're talking a lot about Lake County. Sure. All right.
A little bit. We adopted the philosophy that we're also resource rich, and to rely on those local resources to develop localized focused programs. That's basically the strategy that we adopted. So far, so good. I think you have a question about fentanyl.
That's coming up next, if you want to roll right into that.
Well, I will tell you that literally every drug sample that we send in is trace of fentanyl, like 100%. And we have no idea what the various amounts of fentanyl are, but it's those lab results, unbelievable. So it's really taken over.
I agree. Dr. Dunlap, you're up next to talk about fentanyl.
So I think Chelsea spoke very eloquently about that. I think that the most important things with fentanyl is that it really does elevate the risk to a level that we haven't seen before during the other waves of the opioid epidemic. And I think it just continues to, press upon us that this is an emergency situation that we find ourselves in, and that it requires innovative strategies from all different angles. I think that one of the biggest things to do is to continue to work to provide low barrier access to medication-assisted treatment, especially with buprenorphine and with methadone, because that data there is very robust in that it saves lives, all-cause and overdose mortality, and it reduces risk of HIV and hepatitis C transmission. So I think that is, at least for me, and I think for a lot of people in the medical community, that's really the number one. And then, of course, increasing access to naloxone, because we know that a lot of these overdoses with fentanyl require a lot of naloxone and a lot of education out there for people, and of course syringe exchange as well.
And I just want to say it one more time because I have the microphone and I can, which is, I'm going to say it slow too, which is any street drug right now that you buy, from marijuana to cocaine to counterfeit Xanax to anything, can be laced with fentanyl. So please, on your way out tonight, grab a PSA fentanyl card, because you can't get this information out enough to people. I had a conversation with a group of high school students that I picked up from a high school around here, and I asked them if they knew what it was, and they said no. And I said, okay, well, since I'm not your parent, who buys drugs on the street? And a few of them said, yeah, we do, and they buy counterfeit Xanax and they buy marijuana. And I said, guess what? It's got fentanyl in it. So you can't get the message out enough to people. And if you leave here tonight and pass this card along to somebody that is using marijuana, cocaine, counterfeit Xanax that they're buying, you could be saving their life. So that's my PSA. All right, coming up next, and I'm going to give this to State's Attorney Nerheim and Chief Mourning. Can you talk to us a little about the law enforcement diversion programs that are out there to get people access to treatment, including A Way Out, and Arlington Heights has the Arlington Heights Cares program. So I'm going to let Chief Mourning go first. Can you talk to us a little bit about your program, and then State's Attorney Nerheim.
Well, we've had our program up and running for, about a year now. Again, we've worked on developing local resources for the program. The whole idea is just to get people in treatment. We're less concerned about enforcement for the addicts, and more concerned about just getting as many people as possible in the treatment. Don't misinterpret what I'm saying. We still aggressively pursue people pushing drugs, particularly at the highest level. We all know that China is a major source for fentanyl in this country. We can't back off of that yet. We know, and you've heard it many times, that we can't arrest our way out of this. We have to get people in the treatment.
So the Way Out program, I talked about it a little bit, but it's very similar, and we're lucky in Lake County through the support of it. I'm not just blowing smoke as Chair Hart approved my budget, but we have great programs in Lake County. We have drug court, mental health court, veterans court. We have diversion programs. We have a new program for opiate-addicted individuals that come into the system to give them a diversion with the intensive treatment they need. And they're all great, but you got to get arrested to get access to help, which was kind of what led us to develop the Way Out program through the leadership really of Chief Gunther from Underlying Police Department, and him really taking this to the level that it's at to make sure that we had a county-wide program that would allow anybody, whenever they're ready, to access treatment through the police. And we knew when we built it that maybe that might not be the first place folks would look to when they decided they wanted help. But it's been really neat to see that trust in the community has grown, and people that, again, maybe a year ago would never in their wildest dreams think of walking into a police station and saying, help me, are now doing that. And it's been awesome to see. It's been really neat to see the culture of law enforcement shift 180 degrees. You have officers now that are hugging people when they're coming in. These are officers that a couple of years ago were arresting people. So, it's really been transformative. It's fun to watch. But again, we continue to run into problems with regard to access to treatment, which we all have to work on. So.
Thank you so much. So the next question is for Cole. You ready? All right. What recovery supports in this area have you found helpful, and what other recovery support in the area do you think that we're missing to help people early in recovery and to stay in recovery?
Well, for me, in my case, what worked for me, I tried Alcoholics Anonymous and Narcotics Anonymous, and I tried going from treatment to treatment all over the country pretty much. And I never truly got it or, was able to do what I've done since I've been clean until I was introduced to Lift the Lolly and started Smart Recovery meetings. I've been going into Smart Recovery for over 2.5 years now, and I still attend them. And I really dedicate those meetings and Lift the Lolly for my sobriety. Also working with a psychiatrist and taking medications as prescribed, and Suboxone has been a big help for me. And what else? What we're missing? I was pretty happy when I saw that Stevenson High School's got naloxone now. I haven't heard about my high school though. I'm kind of upset over that. I think they need to get off their high horse and realize that they've got a problem too. I'm not going to say what high school it was, but
I know there's a lot of people in this room. I thought most people might already know.
yeah. Well,
It's an advocacy opportunity. We can look at it like that.
we could. No, but seriously, Lake Zurich High School is in denial. I was telling somebody earlier that I could write, it's sad, but I could write a book of just first and last names of people that I know that have passed away from substance use disorder. And it sucks, but it's the reality and it's truth. And I don't know how much more else I could say, but without Lift the Lolly and Smart Recovery, I wouldn't be here. So.
Well, you couldn't just hear Laura, but she said you did the work.
Yeah.
And by law, thanks to the state of Illinois, I'm pretty sure whether they want to or not, Lake Zurich High School probably has naloxone now. But because the state of Illinois passed a law, so all school nurses, middle school through high school, have to have 2 naloxone in their nurse's office now. But that was thanks to Chelsea's work. And we have wonderful legislative people here, but I will say that. All right, cool. The next question is for Diane Gieser from Cherry Hill Counseling. Well, yes, there was her Bruce Johnson too, who is not here, but now you get it. Okay. All right. What do you think the biggest barriers are to getting people into treatment, keeping people into treatment, and treatment continuum? And what can we do better?
This is a tough question. But Chelsea sent me an article today, and it was an article that was written about her and her brother, and it said urgency for treatment has died. And that was the quote. And I started thinking about that and what you were talking about, Sandy. Of when people get into treatment, we cut off their benefits or whatever, but when we talk about, and the panel is talking about, we have a lot of resources. We have resources, but they're like in silos, and so one person can do this and this one can do that, and we need to cut these silos and make it one avenue that people can get access to treatment. And we need to start earlier to do this with prevention and harm reduction. I think that we're missing, we don't have to wait until somebody's at the bottom of their use to get them into treatment, and that seems to be, it's sad that we've gone from, when I first got into this field, there were treatment centers on every corner, and people got long-term help, and there was housing for them, and there were a lot of things, and we went away from that, and we criminalized it again. And we made it a moral issue. We've made substance use a moral issue again. And I think we have to go back and take a look at what needs to be done and how we can bring these resources together, because a person can get into treatment. If they come out of treatment, they haven't got anything. They don't have medical benefits, or they don't have a doctor. And so it's just a setup for them to not be successful in the recovery path. So I think the silo is a big thing, and I think the other thing that Chelsea mentioned is critical is the education in the community, to have a dialogue, to be able to talk. I spent this past month just talking to some of my own parents about the fentanyl, and they were like, oh no, it's not that bad. Oh no, it's not that bad.
Everybody's awake.
There's a noise I haven't heard before.
But anyway, and I just saw the parents, the denial, and then as their daughter got worse and worse, and we talked, they went home with fentanyl strips this week. So this education, and sometimes it seems like you're talking to a dead ear, or no, somebody isn't getting it, but they do get it eventually. So what's going on? Why is this thing popping? So anyway, the education I think is important. I'm not sure I answered the full question, but I think the silo education, being able to do what Chelsea did, their family, sitting around and going places and just keep talking about it until people understand that we do have an epidemic here and that we do need to bring our resources together. And we do have successes. We do have successes. People are getting better. So that's my answer.
All right, so I've just been told by somebody smarter than me that there's a chance if you have your phone on vibrate and it's buzzing, the microphone is picking up on that. So if you wouldn't mind for the next 12 minutes, if you could put your phone on silent, that would be great. Unless you really enjoy hearing that noise, then you can keep it on and we can keep on going. But if you don't mind putting on silent, it sounds like we're having, for the wireless mics picks up the vibrating of your phone. So that's what that is.
Microphonic feedback.
Oh, wait, what is it?
Microphonic feedback.
Alex says it's called microphonic feedback. So we have all learned because that's not what I'm going to call it.
I love that it's my favorite face.
It's your favorite face? All right, I have a lot of questions, and a lot of them are actually very similar. So I'm gonna roll them all together. But the first one that I think is really important, and I'm gonna give this to Dr. Dunlap, which is, what is fentanyl, and why is it so terrible that it's laced in street drugs? And what can happen to you if you take something that has fentanyl in it, whether you know about it or it's a surprise?
Okay, so the fentanyl that we've been talking about this evening is the illicitly manufactured synthetic opioid drug, fentanyl. That's different than so a doctor could prescribe fentanyl. Usually it's used for really severe chronic pain, like end-stage cancer pain. But the issue that we're talking about now is the illicitly manufactured drug that is being put into the drug supply without the user's knowledge of it. And the reason why fentanyl is so problematic and it raises the risk level so much is because it is much more potent than morphine, much more potent than heroin. It's 50 to 100 times more potent than morphine. And so even for people that have been using for a long time or have tolerance or have done a lot to kind of manage the risk and use safely, it really makes things very, very unpredictable. And as we've said, it's not just in the supply of opioids like heroin, it is in a lot of other drugs. And so it's...
Yes, sir. I just have one clarification.
Sure.
Isn't fentanyl used to put people under for surgery?
Yes, it is. So yeah, it's used for medical reasons, but the fentanyl that we're talking about here is for the most part the illicitly manufactured drug. And it is problematic because many times a person that is using drugs cannot really identify easily if that is present in the drug. And so it makes it just much more difficult for them to use safely, to make appropriate decisions. And it can make things like resuscitation during an overdose situation much more difficult because it is so powerful. It may not take just one dose of naloxone, it may take 6. And so it becomes much more difficult not only to prevent tragic things from happening, but then also to respond when something does happen. It can be more difficult. Other questions about
All right, thank you. This one is for Cole. What are more ways that we all can support people in early recovery or those struggling with substance use disorder?
Try to at least put an effort into getting a better understanding if you don't have one. At least try, because I go to you never quite understand if you've never done the drug yourself. You'll never quite be able to wrap your head around it. But there are ways to get an understanding and to become aware and to know how to deal with substance use disorder and how to go about helping somebody with it or helping yourself. Forgot the question.
How can we all help people more or provide more support in communities for people who are either early in recovery or struggling with substance use disorder?
What can the family do?
Hold up their end. You can't just expect that person to change and it all be good and fine and dandy. It's not how it works. You gotta adapt to the situation, and you have to, like I said, at least try to get an understanding and try to better yourself to help that person in the process. It's a two-sided street. It's not just one person gets clean and that's it. It's not how it works. You have to work together. It's a team kind of thing. You know.
So this next question talks about providing naloxone. And so the question, and actually I had a couple of them, and I don't know if anybody spends any time on Facebook, but there's a Facebook meme out there that says, I pay this much for my insulin, and, addicts get naloxone for free. So the question really is, okay, well, I don't like it either. I'm just saying. I'm using it as an example. So I'm going to give this question to Chief Mourning, which is, what do you say to people who say you're just encouraging addicts by giving them naloxone, or you're not providing, you're not providing anything, you're just sending them out to use again? From a law enforcement standpoint, do you want to address that one for me?
By the way, we use Narcan frequently. We're not that large a town, but we've used it 4 times since the first of the year. 7 total overdose cases. Last year, luckily no deaths this year so far. But it's a fairly common occurrence for us to use it. We've been using it now for either 4 or 5 years. Thank you, Chelsea. 4 years. Chelsea was the one who made a public appearance before a number of law enforcement officials talking about the use of Narcan. And that's when we first met. And said, we're very interested in this. We had to overcome some attitudes on the part of law enforcement personnel. But once the first save was made, you could tell the sense of satisfaction on the part of the officer involved. Really made a difference in his life. It's being totally supported by my line staff. It's just part of the organization's culture now. There's no second guessing.
Okay. Would you like to address that one as well?
We covered it.
All right, and we're good. Thank you. This next one is for Diane Gieser, which is how can we do a better job providing and increasing wraparound services to keep people in a continuum of care longer? More support with housing, with support with keeping people in treatment longer.
Wow, good question. I think, again, I think one of the things that would work would be education. I think we have people that go into, I was talking to Dr. Dunlap about it earlier, people that go into an ER room and they're, overdosing, or they're withdrawing from a drug, and they're not getting any help. They're being sent out without, they're stabilized and then they're sent out. They're not sent to another resource. So I think we have a lot of disciplines that address substance use in their own way. The medical field addresses it one way, social workers do it another way. Then we have housing issues where we have sober living, but we're not really working together as a team. So I think, again, the education, I think doctors, I don't know, Doc, but how much education you get on substance use when you go through medical school? 4 hours. Yeah, 4 hours. So now, I'm sending my people to my medical doctor and saying, you need to get a physical. They're going in and the doctor will prescribe them something they can be addicted to when they have a substance history. So we have to help each other. It's not about blaming, the doctors can blame the social workers, or that we can blame them. I think we have to really work together. And I'm going to have Chelsea do this, and then it'll happen, but I think if we can get some forums together and work together as disciplines that we can, I know when I worked at Lutheran General Hospital, we work so close with the 12-step community. We work with the psychiatric community. If we had a patient on a psych unit that had a substance issue, it wasn't like, well, we're going to keep them in this bed because we're getting the money. It was put them where they need to be treated, and we work together, and we have long-term, so there's not this silo that I'm talking about. There wasn't this competition, who's going to do it, but we're only going to do it because we're getting the money. We're not looking at the long-term effects and what really we need. It takes a year and a half for somebody's brain to heal who's under has used any kind of a substance. And we're giving them treatment for 28, 38, a couple weeks and saying, you're good to go. find your own housing, find your own job, whatever. So I think we need to go back and look at how we can work better together as a community. I hope that answers the question.
That was good. All right, last question, because we're getting close to that magic mark. And this is for Chairman Hart and then Staci Chairman Nerheim, if you'd like to try to promote compassion in our communities for those struggling with substance use disorder, their families from a community standpoint in Lake County, and then from a law enforcement standpoint as well.
So the question is, how can we better promote compassion? And I think it's events like this. I think it's the work. I think it's for people to understand that, this is every demographic, right? Every school. So whether it's, a low-income community, a high-income community, it is a substance use disorder. It is not something that somebody has done wrong. I think really understanding that helps people see that it could happen to anyone. I was in DuPage County, and the guy said, there was an FBI agent who lived in surrounding area, who lost a son to an overdose, right? So this can happen to anyone. I do a lot of work around serious mental illness and reducing stigma, and I think it's the same thing, right? It is knowing that we're all in it together. It can happen to any of us. It can happen to our sons and daughters. And I think whomever said it first, it's talking about it, right? And talking about the things that are happening in our own lives and being unafraid and allowing ourselves to be vulnerable and allowing ourselves to be real. And then that gives somebody else the courage to say, you know what, that's happening to me too. So, and before I end, I just want to say to the guy who did the rap at the very beginning, I thought that was just so amazing, right? And that's like, but I mean, I think his words said it all, right? I mean, you grow up, you see those pictures, and you think, that can be anyone. And as we understand that, and we know this is happening to seniors too. So really, no one is immune, and I really believe that people are understanding that. So thank you.
Just to kind of piggyback on that, Laura and I have a friend of ours that's an ER physician that we go around and we talk to kids about this issue. And he tells a story. He's an ER physician, and he travels, and he goes from any hospital from like Libertyville all the way north to Green Bay and everyone in between. And if you just think for a second, all the different communities that are represented. So you have all of Lake County and Milwaukee, Kenosha, all the way up to Green Bay. Every single shift he works, in every one of those hospitals, there's an overdose that comes in. And that really, I think, highlights pretty clearly how significant of an issue this is. I'm preaching to the choir in this room to tell that story, but it really is, it's telling. As far as to answer your question, I think the best thing we can do is lead by example. We have to be compassionate, we have to show compassion, and hopefully other people will follow. One of my favorite stories, Karen Elbert from Gateway allowed me to come and sort of confidentially talk with the first person that came into the Way Out program a couple of years ago. And I asked her, I said, I'm just curious, what were you thinking when you came into the program? What made you do it? And she said, honestly, I thought the whole thing was a setup. I thought it was a trap. But I went in anyway because I was kind of at the end of my rope, and if it was a trap, it was a trap. But she said, that officer gave me a hug. And I know I told that story before, but that's the kind of compassion that when she tells that story to her peers, word gets out. And again, whether it's us, whether it's police officers, treatment community, showing compassion and leading by example, I think is how we do it.
I just wanted to say one more thing about the question you had asked before. You know, how does a family or friends go about, you know, helping somebody that's struggling with substance use disorder? And you know, it sucks what I put my family through, and you know what we had to go through and endured or whatever. But at the same time, you know, looking at it now, it made us closer. It made us a more tight-knit family, and it made us closer, and it made us realize how much we really mean to each other. So, in an ass-backwards way, all this brought us, you know, closer together, and I'm grateful for that. So.
I just want to take a minute to thank everybody that sat on the panel. I thought we had some great answers to the questions that we asked. And the conversation will continue, absolutely. So would you like to talk?
No.
Okay.
Just being supportive.
Thank you. No, I thought, you know, I've done a lot of these panels over the last 10 years, and I know what it's like to get asked to sit up, and so I want to say thank you on behalf of Live for Lolly for taking the time out tonight to come out and help us mark this 10-year anniversary and talk about what's coming up next, so thank you.
The family and our collaborative, all of these people are included in that group. I can't even tell you how many presentations Mike's done, for example, and he leaves his family, he's got 3 kids on a, what day is it, Thursday night, to come out and do this. Like, you don't have to, you do it, you know, and same with you guys. So, do we have any final announcements? Well, oh yeah, I think Kyle is going to perform another song. Billy Ambition and Alyssa.
Yeah, hello. Oh, thank you. Hello. So this is an original song. We made music together. And given the topic of tonight, this song is called The Stigma. And I myself personally have gone through a lot of struggles with mental health conditions, depression, anxiety, addiction myself. 4 years sober now. And this song was written in the first year of getting sober and dealing with a lot of stigma around mental health and addiction. And we're going to share it for you right now. Sometimes I feel like nobody understands. You open up, but it never goes as you planned. You put your heart out, and what you get in return, looking for a woman brace, but instead you got burned. They tell you it's your fault. You're doing this to yourself. They think you're going to pour salt and perpetuate the negative stigma of mental health. How would you know if you've never been in my shoes with no power to choose? It's more than singing the blues, and now I feel ashamed and alone. Sometimes the hardest part is doing it on your own. How much longer will the stigma remain? We're forced to suffer in silence, pushed in a corner of shame. Hypochondriac, that's what they call me. I question myself, is it all me? Am I really to blame for all this pain? It's not a medical condition, but a figment of my brain. I'm weak, that's what they make me think. And deeper in the hole I sink. As I'm dealing with this burden ain't enough, I've been looking for love and got my self-esteem crushed. And it's experiences just like this, when you want to get dismissed, your feelings get dismissed. Sometimes that's the reason people happen like this. How much longer will the stigma remain? We're forced to suffer in silence, pushed in a corner of shame. How much longer till we're all viewed the same? Why does the stigma continue? I think it's time for a change. And how much longer till we're all viewed the same? Why does the stigma continue? I think it's time for a change. Detached, that's how I'm feeling lately. I'm out of my body and feeling spacey. It's like the me I've known for years has disappeared. I'm just a shell of a person now that's no longer self-aware. But who can I tell without feeling crazy? Seems like no one can relate to the symptoms that I've been facing. I look for hope and turn the pages of the book, and when I try to explain, all I get are perplexed looks. Already know what they always trying to tell me. Stop focusing on your issues, dismiss it, it ain't healthy. Seems like everyone is critical unless your problem's physical. No sympathy for mental health, let's blame the individual. How much longer will the stigma remain? We're forced to suffer in silence, pushed in a corner of shame. And how much longer till we're all viewed the same? Why does the stigma continue? I think it's time for a change. And how much longer will they, yeah. And how much longer till we're all viewed the same? Why does the stigma continue? I think it's time for a change. Thank you very much. If you guys want to find out more about us and what we do, please talk to us. Thank you so much for listening, and thank you to Chelsea and Rick for having us.
Yeah, they're available to perform treatment centers, parties, organizations, whatever. Like Kyle's my oldest friend. I've known Kyle since I was like 2. Yes. I thought I was going to marry him. I didn't. Well, that's what you think when you're 2. But I think it's really important that the people sending this message are also able to present that in front of other people who are potentially going through something similar to them. So if you have an opportunity for them, I mean, I know they would be grateful for it. They're obviously very talented. So we're done. We have reached the end of the evening, and there's still food. And I just want to thank again our panelists. Thank you so much for coming. You guys are all I just want to say as well, you know, seriously, we're going to have a lot of events this year. We have a pop-up event coming up. We have, I don't know when that's going to be. We have our golf outing that's going to be coming up in July. We have a big gala at the end of the year in November that we're going to be doing that my mom is planning. But we're really grateful again. And, you know, thanks again for coming. And I just want to say last that I don't think I said this enough, but my mom really is like the rock of this organization. She does so much. Who creates a network for moms that have lost kids? I mean, she is literally, she just expanded out her Angel Moms Network. It goes beyond Illinois now. We're allowing other moms from outside of Illinois into the online network, connecting moms with other moms who have lost children to overdose. And now she's starting on a new venture, the Angel Moms and Siblings Advocacy Committee, who will be coming to a park doing a rally for children because they are so motivated to spread awareness, share their stories, and really kick these hospitals in the butt because they really could be doing a lot more. So again, thank you all for coming. And if you want to get involved, please see Phil, please see any member of our team, and we love you all. Thank you.